I was interested in science and math from a very, very young age, but then I really got interested in medicine when I was around 14 to 16 years old. I started to volunteer at local hospitals, and I initially became an X-ray transport orderly, a radiology transport orderly at Mount Sinai Hospital in Cleveland. And there were a few patients, one in particular that I remember that I ended up bonding with these patients and followed them through with their hospital course. And that really, I think, developed a sense of empathy and caring about people and how medicine could help people. And so from a very young age, I loved science, and then I loved taking care of patients. And so for me, cardiology, as I learned more about medicine, really met what I enjoyed. And because it's a macro science, the heart's kind of the center of the soul. And I could visualize the heart pumping, I could understand the 4 chambers and the valves, I could see it. And it also links to every other, organ in the body, from the brain to the kidneys, to the liver, to the periphery, etc. And so to me, it really was kind of at the center of care for patients, and I just gravitated towards cardiology. For me, the full life in medicine, you can be very happy and you can make great contributions just by taking care of patients or just by working in a lab. But to me, I think what's very special is by being able to be a multifaceted physician who takes care of patients, does clinical research, and teaches. And that's what I patterned my life after. And I started doing research when I was young. In undergrad at the University of Michigan. And the important thing there is to get involved early and to identify mentors. Mentors who want to work with young people, who want to train the next generation of researchers, of physicians, cardiologists, whatever the subspecialty is. And at each stage of your career, go to the best center that you can, where they'll have the best mentors that you can work with that, will, match your passion.